A traditional call light tells staff that someone needs help, but it usually does not explain what the person needs. The resident may need the bathroom, pain assistance, repositioning, water, a brief change, food, or urgent help. Staff hear an alert, but they begin with a mystery. CareCueD was created to change that. It is a resident-first care request and safety platform from MediSync Technologies, LLC, designed to transform one vague signal into a clear, routed, timed, and accountable care workflow. The ordinary call light model creates unnecessary uncertainty. A certified nursing assistant may walk to the room only to discover that the request belongs to dietary, housekeeping, social services, maintenance, or a nurse. A bathroom request may wait behind a less urgent task because the system cannot explain fall risk. A resident with pain may press repeatedly without knowing whether anyone understood. CareCueD begins with a simple principle: a resident should never have to press a button and hope someone guesses correctly. The resident interface presents large, easy to understand request choices. A person can select bathroom help, pain, ice, water, repositioning, a brief change, a snack, room assistance, or another approved facility service. The screen is designed for clarity, accessibility, and low stress. Facilities can configure language, symbols, contrast, button size, and available requests. Voice, touch, and soft touch options can support residents with different physical, visual, or communication needs. Accessibility is not an extra feature, it is part of the safety architecture. CareCueD can support large targets, high contrast, simplified wording, multilingual content, voice guidance, and soft touch controls. The goal is to help residents communicate as independently as possible while preserving dignity. A future deployment can also consider switch access, bedside mounting, tablet placement, and resident-specific preferences according to facility policy and clinical appropriateness. Once a request is submitted, CareCueD routes it according to the facility's approved workflow. Bathroom, repositioning, and brief change requests may go to the assigned nursing assistant. Pain, breathing concerns, or clinical changes may require nurse review. Food and drink requests can respect dietary restrictions. Environmental issues may route to housekeeping or maintenance. Social, activity, or emotional support requests can be directed to the correct department. Routing reduces unnecessary walking and helps each team see the work that belongs to them. CareCueD is designed to close the communication gap after the button is pressed. The resident can receive confirmation that the request was received and, where appropriate, that a team member has acknowledged it. The screen can display a calm status message instead of leaving the resident uncertain. If the request is delayed, the system can follow approved escalation rules. This does not replace staff communication. It helps make that communication visible and consistent. Different requests carry different levels of urgency. A forest bathroom request should not be treated like a routine blanket request. CareCueD can apply facility-defined response thresholds, reminders, and escalation paths. A request may begin with the assigned staff member, then escalate to a nurse, supervisor, director of nursing, administrator, or compliance role when it remains unresolved. The purpose is not to punish staff. It is to prevent important needs from disappearing during a busy shift. Bathroom assistance is one of the clearest examples of why CareCueD matters. With a traditional call light, staff may not know that the resident is trying to get up alone. CareCueD can identify the request immediately, display approved forest context, route it to available staff, and begin the response timer. The workflow can record acknowledgement, arrival, assistance, completion, and any required follow-up. It supports safer coordination, but staff still use professional judgment and emergency procedures. Pain and changes in condition require a different pathway from ordinary service requests. CareCueD can route a pain request to the nurse, show the resident's approved care context, and document that the concern was reviewed. A nursing assistant can also submit a concern for nurse verification, such as new confusion, weakness, skin changes, breathing difficulty, or unusual behavior. CareCueD supports communication and chronology. It does not diagnose, prescribe, or replace immediate emergency action. CareCueD can support preventive routines that are easy to miss when work is fragmented. Shower day workflows can prompt and approve scan observation and route concerns for nurse verification. Repositioning requests where reminders can be tracked according to the care plan. Staff can document completion, concerns, and follow-up without silently changing prior history. These functions require facility policy, clinical leadership, and appropriate documentation standards. A request for a snack, ice, or water may appear simple, but the resident may have a fluid restriction, swallowing precaution, allergy, diabetes plan, or texture-modified diet. CareCueD can display minimum necessary approved guidance so staff can respond safely. The system may suggest an approved alternative or route the request to dietary or nursing review. It supports the plan of care. It does not create or change that plan independently. CareCueD is designed for multiple roles. Residents see accessible request choices and status. Nursing assistants see assigned care requests. Nurses see clinical concerns and verification tasks. Supervisors see overdue work and escalation. Administrators and compliance personnel see operational trends and unresolved exceptions. Dietary, housekeeping, social services, activities, and maintenance can receive department-appropriate requests. Role-based access helps limit information to the people who need it. The CareCueD Guardian Network connects the people responsible for completing and overseeing care. A request can move from the resident to frontline staff, then to a nurse or supervisor when the workflow requires it. Administrators and compliance leaders can review unresolved or repeated issues. Authorized family communication may be added only under facility policy, resident rights, privacy controls, and appropriate consent. The network is designed around accountability, not public surveillance. Dominique 2.0 can serve as the conversational assistance layer inside CareCueD. She can explain why a request was prioritized, summarize what remains unresolved, prepare an end-of-shift review, or help a supervisor understand repeated delays. She can remind staff to document completion and translate complex workflow language into clearer steps. She does not respond to the resident, make clinical decisions, or replace the staff member who is responsible for care. At the end of a shift, CareCueD can require an approved review of open and recently completed requests. Staff can confirm what was completed, identify what remains unresolved, and transfer responsibility through a documented handoff. Supervisors can see patterns that require attention. This creates a clearer operational record than memory, hallway conversation, or a disconnected note. The goal is continuity of care, not paperwork for its own sake. CareCueD can organize response activity into reports for quality improvement and authorized compliance review. Leaders may evaluate acknowledgement times, completion times, escalations, repeated requests, department workload, and unresolved exceptions. A monthly compliance packet can preserve approved summaries and audit chronology. The report should be used to understand systems, staffing, training, and risk, not to make unsupported accusations from one number alone. The Facility Command Center gives leadership a real-time view of requests across rooms, units, and departments. It can show open work, priority, acknowledgement, assignment, escalation, and completion status. Workload visibility can help supervisors rebalance coverage during a surge. The dashboard must remain resident-centered. Every icon represents a person waiting for help, not merely a performance statistic. The CareCueD direction supports Windows workstations, web and progressive web access, tablets, and mobile staff workflows. Offline first functions and secure synchronization can protect continuity during connectivity loss. Every deployment requires role-based access, encryption, audit records, backups, incident response, and resident rights protections. A responsible pilot begins with workflow discovery, synthetic scenarios, staff training, supervised acceptance testing, and clear measures for request clarity, response, escalation, workload, safety, and resident experience. CareCueD is the real resident-first care request platform. Code Blue. CareCueD demonstrates the difference between traditional call lights and clear requests through gameplay. NurseQuest trains learners to prioritize, communicate, respond, and escalate. Dominique 2.0 provides conversational guidance across the ecosystem. Together, the products tell one story, improve how care is requested, understood, taught, completed, and reviewed. CareCueD is created by MediSync Technologies, LLC. Jason Allen Henderson is founder and chief executive officer. Dominique Danielle Henderson is co-founder and founding inspiration. The mission is simple but important: give residents a clear voice,